Hello, everybody. How are you doing today? If you can hear me well, please let me know in the comments. Please give me a thumbs up if you can hear me and see me well. Let me quickly introduce the topic for today's session, and it's going to be speech development and delay in children. One of the topics of major concern in growing kids is speech development and delay in children. And for this session, we have with us Dr. Santosh Kumar K. Dr. Santosh Kumar K is the senior consultant in the Department of Pediatrics and Neonatology at Motherhood Hospital, Barnashankari, Bangalore. He has 13 years of experience in this domain. He has a distinctive interest in neonatal emergencies and general pediatrics. He has a great zeal and passion towards care for high risk premature neonates in the neonatal ICU. Dr. Santosh leads the neonatal wing consisting of 18 bedded level 3 unit handling around 1500 to 2000 deliveries per year, which consists of around 30% of high risk deliveries and around 450 to 600 NICU admissions per year. Welcome to the session, doctor.
Thank you, Dr. Shweta, for a kind introduction.
Doctor, any opening thoughts for the session? Your screen is frozen, doctor. Doctor, your screen is frozen. I'm not able to see you or hear you.
Is it all okay now?
Yes, I can hear you now.
Yeah. I think there's some amount of network issues. I think so. But anyway, thank you for the
Yes.
introduction. Again.
Okay. So let's dive right into our first question.
Yeah.
Doctor, what are the typical speech development milestones in children and when should parents start to notice them?
Yeah. The typical speech development and language development in any neonate that is born. So initial 6 months is all that coos and vocalizes. A lot of sounds that you hear from the baby, making different types of sounds. So during the first 0 to 6 months, what a parent should observe is whether the baby is making a lot of sounds, coos and vocalizers. Between 6 to 12 months, if the baby is able to make a two-letter words and trying to pronounce them, something like baba, mama, no, no, something like that, using a two-letter words. Then normally what we observe in the babies between 6 to 12 months. Between 12 to 18 months, that is where a baby will start to at least use around 6 to 7 words of 3 to 4 letters. Mama, dada, want, no, something like that words. They start using between the age of 12 to 18 months. Between 18 to 24 months, that is when we'll expect a baby and a toddler to at least have 50 variety of words to pronounce. Pronunciation will not be accurate, but at least a 50 different types of words where a child can pronounce. And at the same point of time, it is where we start to appreciate the receptive language and expressive language. So these are basics of speech and language development, which a parent should notice in the children.
Okay. I believe there is some network issue happening at doctor's end. So all the viewers who are watching us, please let me know which city you are joining us from. And also to everybody, one lucky commenter is going to get a goodie from SuperBottoms. So please ensure you are adding your questions in the comment section below. And as soon as we are able to proceed with the session, we will be taking up your questions and answering those as well. Let's give it a few moments for doctor to join back. And in the meantime, you can think of all the questions you want to ask him on speech development and speech delay in children. Please put them up in the comment section. And one lucky commenter will win a goodie from SuperBottoms. I believe his network is completely gone, so that is why he has dropped off from the session. Let's wait for him to join back. Let's play a small game in the meantime. Do you all remember the first word your child said out loud, or the cute version of any word that your child has said out loud? a very cute version that your kids would say in a babbling way? Please let me know in the comments.
I think am I audible now?
Yes, yes, you're audible,
There's
doctor.
some network issues. Sorry.
Yes, I can see
Okay.
you more clearly now. Please go
Yeah.
ahead.
Yeah. So the basic language, speech and language development that the parents should notice, as I said, it is divided into four domains until 2 years of age: 0 to 6 months, 6 to 12 months, 12 to 18 months, and 18 to 24 months. So between the 0 to 6 months, it is basically a lot of vocalization and cueing of sounds from the baby. Between 6 to 12 months, an infant will start having at least using two-letter words, baba, mama, dada, something like that, starts to use those words. Between 12 to 18 months of age, where the child will at least use six different types of words, at least 3 to 4 letters of words. And between 18 to 24 months, there where we see at the end of 24 months, at least the child will be able to pronounce it or utter around close to around 50 vocabulary words. So this is what basic information on the speech and language development, which a parent should notice. At the same point of time, between 12 months and 24 months, you should also notice about the receptive language. So whenever we say about language, there are two things that a parent should know. One is receptive language, one is expressive language. So when I give a command to my kid, when I give a command to my 18 months old toddler, I think you should be able to understand those command and at least give a gesture or reciprocate to those words. This is a basic development that a parent should expect in their children.
Right. Okay. And what factors can influence speech development in children? And are there any red flags for potential speech delays in a child?
Yeah, see, what we advise the parents is a lot of interaction, a lot of communication with the infants and toddlers. So any child who is less than 12 months, we call them as infants, and between 12 to 36 months, we call them as toddlers. So a lot of interaction, communication should happen between them. That is one of the most important things of good language and speech development. Second thing is when you say about language, it is the common language that we speak with the child. Suppose a parent is has a mother tongue of Marathi and a mother has a mother tongue of Kannada, and grandparents speak some other language of Hindi or something, and so then the problem arrives where the child is unable to understand all three languages. So that becomes a problem. So one is a lot of communication with the child. Second thing, using a one common language to communicate with the child. Second thing, for every action or every purpose, you have to express that need of the work and make sure that the child understands the same. So initially, the child always learns a good receptive language. Once the child learns a receptive language and one common language, then the child starts expressing the language. So these are basic things. Now, suppose the child is not even uttering 1 to 2 words by 1 year of age, or doesn't have any control over at least variety of 10 to 15 words by 1.5 to 2 years of age, then the red flags arise where you have to consult your pediatrician to do a basic assessment and then further follow from there whether any speech evaluation is required, and then from there any therapy is required is determined.
Right. Okay. But doctor, it is also some people suggest that talk to your child in as many languages as possible so they pick it up at an early age. Is
See
that a
what
myth or is it
it, it
okay
is
to?
it is it is just a myth. The problem is, see, the use more languages, the more receptive language will develop, but not the expressive language. If you want your child to talk, then definitely you have to be having one common language for it to understand and reciprocate. Now suppose I speak five different languages to a child, the child will understand all different five languages. So by the age of 2.5 3 years, the child whoever speaks in those languages will understand better, but the child will have a confusion which language to reciprocate back to the statements. So that will become an issue. So definitely it's a myth. So you should use one common language for the baby to understand the language.
Okay. Can you express? Yeah, you just shared that right now. Can you explain the difference between speech and language development and how they are interconnected?
Yeah, basically speech is the pronunciation of words. Now, how do we pronunciation words? How well the baby picks up the word, expression of a word. The language is what is used for communication. Now, suppose a child has to communicate what it requires, he should understand one common language, which it is very good in reception, and from there it again expresses that language. So speech is expression of words, and language is to understand or communicate to the other person. So both are interconnected. Both requires good amount of communication between the parents or the caregivers to excel in them.
Right. What role does early intervention play in addressing speech delays, and how can parents recognize when it is needed?
Yes. So one of the thing is, suppose if the child is around 1.5 to 2 years, now we normally have an old literature where it says a girl child should be able to at least speak a few words by 2 years of age and boy by 3 years of age. Nowadays, we have little changes in the recommendations, and we express now the children are put to play home or the Montessori way of studying at the age of 2 years, 10 months. So by 2 years, 10 months, when these children go to a play home or an Montessori way of learning, at least they should be able to at least express the words, what they want, what they need, and when the child the exam when the teacher asks them something, they should be able to reciprocate to their needs. So these are something which is very important. So by the age of 2 years, if a child is not able to at least communicate the basic simple words, I want this, I don't want, making two words as a sentence and framing them and trying to talk. If it is not happening, then definitely you have to consult for an interventional program where a pediatrician will assess, then refer you to a speech therapist or whatever is required. Again, the parent should not feel uh, the burden of speech therapy and something majorly is happening and nothing like that. Speech therapy is actually it is not for the baby or the child or the toddler. It is actually for the parents. So the speech therapy is trained to the parents in a what way they should communicate with the children, so that this child's speech and language improvement happens. So by 2 years, if you see your child is not able to express a basic simple words of communication, then definitely you have to see your pediatrician and take his advice.
Right. Okay. Okay.
What was
Are
second
there,
part of the question? I just forgot the second part of the question which you asked for.
yeah, and how can parents recognize when is an intervention required?
Exactly. That's what. Again, 2 years. Now, 2 years, 10 months is the starting time of a play home or a Montessori for a child. So, by 2 years, if you're not seeing these things, or any point of time, as I told you in the first question itself, if it is not vocalizing or cooing or vocalization not happening by 6 months, or the baby is not using simple to non meaningful words between 6 to 12 months, or at least using 4 to 5 or 4 to 6 words, meaningful words by say, 12 to 18 months, or at least 25 to 50 words. If it is not happening, then you have to consult your pediatrician.
Right. Okay. Doctor, as I said, the myth that you just busted about speaking to your child in multiple languages, are
Hmm.
there any more myths or misconceptions like these about speech development that you would like to bust for us?
Yeah. One is that, see, always communication is the key to improving language. Now, how do you improve this language? Is one, trying to make sure the child has a lot of interaction in the family at the place where the child is bred or brought up. Now, whether the grandparents or parents, for every action or everything, don't be idle. For example, a baby is a time to give her a feed. Now, we'll not just get the milk and give it there. So we'll try to communicate with the child. I'll tell the child, do you require a feed? Do you want to drink milk? The child will definitely start to reciprocate, and child will try to understand what you're communicating with the child. So this is how you start your thing. So any activity, any action that you do with a child, try to reciprocate and get a gesture or an voice note from the child, so that it is the child is able to understand what you're communicating with them. One. Second thing is, again, as I told you, multiple languages, too much of screen time, or making the child listen to too many of rhymes of different languages is not advisable, because again it will delay the expressive language, not the receptive language. So expressive language is very important for a child to have a good scholastic performance in the beginning years. So no too many languages, one common language which the family is able to speak with the child, and everyone commonly speak the same language with the toddler or the child. Now, third thing is, again, if and suppose if the child has got a bit of speech delay, don't get scared. Speech therapy is not for the kid; it is for the parents to understand how to train your child. So don't get the burden of whether the child has got something majorly with and how to go about it. And all this is not an issue at all. It is just to train you how to reciprocate, how to communicate with your child. These are
Right.
some of the myths. And there's nothing like honey. Some people say give honey by 6 months or 12 months, maybe speech will improve, the tongue will reciprocate, and all those things. And nothing like that. It is how much good communication you have with the child, that much fast the child will have a good speech and the language.
Okay. But often we see that the mother tongue is the regional language where the family stays, and the school is often in a different medium of language, like, say, for example, English medium language. So, at 2.5 years of age, the child might be communicating in a very basic format and they start learning in English or communicating in English with their teachers. Would that
Yes.
hamper language development in any way?
No, that doesn't happen. That is why what we said is initial first 2 to 2 years, 10 months, one common language is always better for child to understand and reciprocate. Then you can introduce. I'm sorry. Once the child is comfortable with that language, you can further enhance post 2.5 to 2 years, 10 months. You can enhance other languages where the child is very good in reciprocating to those languages also. But in the beginning, until a child learns a language understands to speech for a speech, you should introduce one common language.
Okay. And what strategies can parents use to promote language rich environment at home to support speech development?
Yes, again, it is basically very important is communication, a lot of communications. So normally, what we tell our the parents who come to our outpatient department and they express concerns about the language and speech where it is still normal, but still they have their apprehensions. What we say them is one, try to communicate a lot with the children. For example, there's a rhyme. You want to sing a rhyme, sing it with the child. Try to sing a rhyme to the child, or sing a song of the same common language, or try to read some book or something of this common language which the child will understand. So there's some way having a lot of communication and interaction with the child will help at the free time. So parents should involve actively whenever they have a free time to communicate a lot with the children rather than being idle or not reciprocating with anything or putting them on some screen time or something like that. It is better the parents themselves start to interact with them.
Okay, okay. Let's pick up a viewer's question, doctor.
Yeah.
My daughter picks up both languages we speak at home, but shows less interest when it comes to write alphabets in both languages. Should I be concerned?
No, I think again, the writing is something which will take little more time, probably 3 years, 3.5 years, like that. But what we have to look at, and initially for till the 2.5 to 3 years of age, is more of language communication. If a child is picked up two languages, very good. But if the child expressing the language is what you have to look into. Again, our major concern is always about expressive language. Receptive language, the children is excellent at the age of from the age of 1 year to 2.5 years. Even if you give 10 languages, the child will try to understand slowly all the 10 languages. But whether a child is able to at least express in one language is the key to speech and language development.
Right. Doctor, would you suggest any exercises or games that parents can incorporate in their daily routines to help the child in speech development?
Again, a good, very good amount of time on doing some activity with the child, either a rhyme or a singing or a reading or trying to tell a story in the language. This is something which a parent can do in his free time, which will immensely help the improvement of the language with the child. And at the same point of time, if the child is around 1 year to 1.5 years of time, try to give a questions that leads to them to answer back. Now, when you say, "Where is my pen?" the child will try to respond by saying, either showing a finger to gesturing towards the where the pen is, or at least trying to express, "It is there, or it is," something like that. They'll try to communicate. So always ask them the leading questions. For example, "Can you get my cup? Where is my cup?" So the child will naturally at least say the cup is there, or at least there, or will try to communicate through gesture that the pen is somewhere, the cup is somewhere placed there. So these are some type of communication that you would like the parents to have, where a leading question is asked, where a child by default has to answer that question.
Okay.
Yeah.
And what resources and professionals are available to support parents in navigating speech delays and fostering effective communication with their children?
Yeah, again, there are a lot of resources available on the social media, but what we would suggest is, since your child is going to be vaccinated regularly till the age of 2 years or 2.5 years, it is always your pediatrician the first person to approach and understand how the language development is happening. Now normally in children we do not see much of a language delay until 1.5 year of age. It is between the 1.5 years of age and the 3 years where you notice some amount of delay or some amount of pronunciation problems or some amount of language expressive language issues. In that point of time, talk to your pediatrician, give him an assessment. There are simple charts to write and understand. The charts can be filled by the parent, and based on the charts, the pediatrician will tell you whether the child's development of language and speech is correct, or there is anything else to be done, or there will be a in-house speech therapist or speech assessment developmental therapist where they assess the speech. Post the assessments, we can come to a conclusion whether as the child definitely has speech delay, or it is normal for the child to have this sort of an approach at this age, and then we can wait. If there's a speech delay, then the therapist will tell you how to come to consult, how to go about it, and what has to be done. In the initial phase of time, it is always the parents are involved. Parents have been taught how to communicate, and from there 6 months, we'll see how the improvement is. The most important thing again here is the screen time until 2 years is not recommended. Absolutely no mobile, no screen time. Even for 5 minutes or 10 minutes, it is not allowed. Between 2 to 3 years, I think it is around 5 to 10 minutes, and subsequently there is some amount of criteria for the screen time, which the parents can follow.
Okay. My daughter has difficulty in pronunciation of few words. What can we do for that? Okay.
Again, it is a very common thing in children. I think I didn't get the age of the child.
If you could please share the age of your child, doctor
Probably
will be able to.
Yeah, probably the child is around 1.5 years or 2 years. It is quite normal. Again, as I told you, between 18 months to 24 months, the child will have to at least utter around 25 to 50 words. Now, again, when I say these words, it does not necessarily that a child has to utter it the pronunciation exactly what it is. It can be a little bit of abnormal pronunciation. It is normal, acceptable. Need not to be worried about it. Over a period of time, they'll improve with that. But putting an effort to put up those words is what is important.
Okay. We just have an answer. She said her daughter is 3.8 years old.
Again, if you are showing any screen time, again, if there is any other this thing, probably that could be one of the reasons why there is expressive language pronunciation is not good, because 3 years 8 months at least the words should be properly pronunciated. The only causative factor here could be a screen time, because we do see a lot of children, most of the children from the Montessori's and the play school children refer back to us saying that my child is not able to blend the words properly, my child is not able to utter the words properly. This most common reason is either there could be a mild amount of very mild amount of subtle amount of speech delay, or there could be too much time of the screen time or the mobile or something like that. So that could be one of the reasons. Try to avoid that. Gradually over next 4 to 6 months it should improve.
Okay, great. Doctor, any points you think we have missed out on?
Nothing. Again, since the 2019 and 2020, the COVID and all those things, children have not gone out. They have been stuck to house, and lot of online teaching and all those things. Certainly, the communication, meeting the peer group or meeting the relatives, having interaction with them has all come down. So definitely, we have seen a lot of children similar thing where the parents were unable to handle them, or it is because of the work pressure, or the what you call the nuclear family. Those children have been exposed to a little bit of screen time and all those things. But what we have seen is all the children have shown a lot of progression over a period of time now. Only thing is try to avoid minimize the screen time as many lowest as possible, absolutely zero. Once you minimize the screen time by less than 10 minutes or 5 minutes for a 3-year-old, definitely the speech will start improving. Maybe we have seen probably a 10 to 20% of the children born between 2019 and 2020 having a speech delay, and subsequently they've done well. So probably this is a phase where we have a lot of issues with speech and language development, but definitely it will improve. A good effective communication is what it requires.
Great. Thank you so much, Doctor, for sparing your precious time and being with us here today and sharing all this valuable information with us and our tribers.
Yeah,
Thank you
thank you.
so
It's
much.
an honor to be there. Thank you. Yeah.
Thank you so much, tribers, for tuning in. With that, it's a wrap on today's session. Stay tuned for more such interesting sessions just on Parent Tribe by SuperBottoms. Thank you so much.